Alright, quick look at Chapter 12. I think we only have a couple guidelines here. We're looking at diseases of the skin and subcutaneous tissue. We're in the letter L, L00 to L99. So we just have a couple guidelines concerning pressure ulcers. So we have category L89 for pressure ulcer, and we do have combination codes that identify both the site and the stage. So that's kind of nice. We don't have to code those separately. With these, you can assign as many codes as needed to identify all pressure ulcers that the patient might have. Now, in terms of the stages, they're based on severity, and we'll take a look at the codes here in a minute. There's stages 1 through 4, and then you also could have unspecified, or if it's clinically unstageable. And if there are kind of multiple stages while the patient is there during their stay, we're going to assign the code for the highest stage reported for the site. So I'll pull up that tabular. Here's L89 pressure ulcer. You can see that's a bed sore, pressure area, pressure sore, all synonymous terminology that we can use. And then you'll notice it's broken down into the site, and then you can see the stages here. And it does give you kind of some terms in terms of the stage. So a stage 4, for example, is that we have necrosis. Stage 3, we have full thickness skin loss. And then again, we could have unstageable or unspecified, meaning that we just don't know what stage it is. Alright, so let's look at an example with this. We have pressure ulcer of elbow with blisters and partial thickness skin loss. So on my index, I went ahead and went to ulcer, and I scrolled down to pressure. I'm on page 1226. So ulcer is my main term. Here's pressure, and then I'm coming down to elbow, and I get that L89.0. Again, that dash indicates that I do need some additional characters. So when I come over to my tabular, again, L89.0, I'm on page 557. Pressure ulcer of elbow. Here we have unspecified elbow. So in our scenario, we don't know if it's the right or left elbow, but we do know that it has blisters and partial thickness skin loss. So although it doesn't tell us the stage, it does tell us a little bit about the severity. So in stage 1, we can see pre-ulcer skin changes. Basically, we just have edema here. In stage 2, we have abrasion, blister, partial thickness skin loss, unspecified elbow. So here's that blister and partial thickness skin loss. So I think that we could comfortably put it as a stage 2. So we get L89.002.